Hey, everybody. It is Monday again. Hope everybody had a good weekend, or as maybe now makes more sense to say, a weekend. I am here. I still have not shaved my beard, and we are here for another Donald Trump White House coronavirus press briefing. I had a couple of interesting conversations over the weekend, actually, just about really how I should be covering these. And as you all know, I've had my reservations before because they are so lie riddled and such locuses or loci of propaganda. But at the same time, this is sometimes the first place where new policy is announced. So going all the way back to the 15 days to slow the spread becoming 30 days and so on and so forth. We do hear about policy here. We do hear about from doctors, and the questions are interesting. So I think I am committing to muting Mike Pence. The Mike Pence portion is really worthless. Like, it's acutely worthless, and he's never announcing the new policy. It's always Trump. So I think we've heard enough times Pence say, the White House coronavirus press briefing met this morning. We continue to be impressed by the resilience and cooperation of the American public and the 30 days to slow the spread by follower. Thank you for your leadership, Mr. President. When it comes to PPE and masks, we have scheduled 57 Airbridge flights. The pilots are considering whether they will be wearing sneakers or shoes during those flights. And at a certain point, we are going to be placing another order for 75 million masks. We never know if the masks are delivered. The numbers are essentially meaningless. It's of such little value that today, at least, I have other stuff planned. So we will mute Pence, and I have other things that we can talk about. I'll just read super chats because we're not going to do any more of the Pence stuff. With the Trump part, I'll just try my best to fact check in real time. And then, of course, when we hear from doctors, we want to hear from doctors, although Dr. Birx is increasingly also a vector of disinformation. And we've got Dr. Fauci, though, although he is increasingly rarely speaking at these. And then the questions from the reporters we do want to listen to. And actually, I have some interesting examples of that to play for you from yesterday. Very interesting stuff. Donald Trump highly triggered by being questioned by a woman doing the entire "who you with" and relax, and could you lower your voice, please? Which, if you're familiar with Trump's personality, is not particularly surprising. So, welcome today, scheduled for 5:30 p.m. Eastern time, the bottom of the hour. We've got about a half hour during which we can discuss things. If you don't want to discuss things, skip ahead a half hour if you're watching the replay of this that we've uploaded to our YouTube channel. I see people already getting banned and timed out, which is just delightful. I've not even done anything yet, but people are already furious with me. So the moderators know what they're doing here. We do also have a membership goal today. I'll talk about that a little bit later. First, some updates. First and foremost, we are now on the precipice of 2.5 million global official cases. At this point, we have ranges that the real number is anywhere from 2 to 80 times that. Do I think it's 80? I don't think so. Do I think it's 2? No, I think the official number has to be well more than 2. 170,000 deaths here in the United States. We are now past 750,000 known cases. The real number is much higher. 42,000 deaths. Let's take a look at just the trend lines, and then we'll go up and look at some other things. We still seem to be in a sort of plateau that's beginning to be a decline. But of course, we're starting to see some of those states that people are going wild, protesting and doing other things. We are starting to see cases spike on a percentage basis there. The numbers are still low. If you have 3,000 cases, you might have 300 more in one day. That's bad. But on a number basis, it's not that bad. But on a percentage basis, if every day you're adding 10 to 12%, that's going to get ugly very, very soon. When it comes to active cases, it's starting just to smooth out a little bit. And then looking at deaths, we are again hoping that we are starting to see a peak. We thought we might have hit a peak on April 7th because we had basically a leveling off all the way until April 13th. On the 14th, this is because a bunch of deaths were reclassified as COVID deaths. But in any case, a new peak on April 15th, and then we were back down, then up again, and then now down a couple days. We are likely in a plateau if we continue social distancing. A lot of the let 'em die Republicans are furious about social distancing. Tomorrow I'll have a commentary on the show about that. Lastly, I am not that interested in continuing to show the IHME model because, number one, at this point, we're in it. The model tells us very little. We have the day-to-day. Like, if we're in a peak, we'll know, because soon we'll be at 1,400 deaths a day and then 1,200. The model has often been outside of its estimates. I don't know that there's much value for me showing you the model. What I do want to track daily with you, though, are testing totals, because what is ultimately going to determine when the country can even consider reopening, and when I say the country, it'll be state-by-state decisions, we must be doing more testing. Yesterday, we had a record amount of testing, 167,000 tests. Today, as of 4 p.m., these are updated at 4 p.m., so they're 24-hour cycles. Today, only 137,000. If we want a real shot at reopening, I'm going to give you the tiered, okay? At a bare minimum, like we can't even have a conversation about reopening until we're at 500,000 tests a day. That number may be way too low. Another series of roadmaps say we need to be testing 1 to 5 million per day. And then a couple of roadmaps say you need to be able to test the whole country every 2 weeks, which is about 22 million tests a day. What I can tell you for sure is 137,000 tests a day is not going to cut it. There's not even a conversation to be had at 137,000 tests a day. If we can keep increasing, then we can start to get there. But as you can see, we got to 162 on April 9th, and then it went down. And then we got to 167 yesterday, and then it went down. We need sustained additional testing. Part of this will be new labs coming on, new types of tests, and also eventually, as Dr. Birx said, moving from an RNA test to an antigen test. I am not an expert on that, but that is a way to scale up testing. Dr. Birx saying with an RNA test, you can never test, millions of people a day is unlikely when you're dealing with an RNA test. So we are standing by here for the White House coronavirus press briefing on Monday, April 20th. I want to welcome you if you're watching on Twitter, Facebook, Twitch, or YouTube. If you are watching on YouTube, please do me the favor of hitting that like button and hit the subscribe button as well. Let's look at a few super chats coming in. Waffles Giraffles says, do you miss saying Buttigieg or Buttigieg? I really don't. It's actually stunning to me how quickly I forgot about saying Buttigieg or about Pete altogether. Grace Lee says, who is the cute dog on your Instagram? Is he yours? That's my dad's dog, Captain Nemo, or just Nemo Pac-Man, as I know him. Christy J says, David, what do you know about the delay of stimulus checks and the lack of info on the IRS website? Updates not happening, frustrating as there seem to be no answers. I know nothing other than what's been publicly said, and it seems that there are delays happening for sure. Rocco Delaware says, David, what's your opinion on the people who are protesting the stay-at-home orders as well as the president's Liberate States tweets? I think it's all toxic and disgusting. I have a clip coming out about it later, and I have some stuff to show you as well. So we'll get to that. Rat Cracker says, Ben Shapiro called you out in a video called Ben Shapiro and Steven Crowder discussed the plan to reopen America at the timestamp of 6:54. Watch it. Let's see if I can find that. That's interesting to me. Reopen America. 2 days ago at the 6:50. Imagine if the 6:54 timestamp is something totally unrelated to me and I'm just getting trolled here. That would be funny. It wouldn't be the first time. But let's take a look at it together. 6:54. Let's start it a little early. Here we go.
Because as testing is more accurate, it'll be a smaller portion of the overall infection rates.
And that makes a difference because if we all go out and infect each other, and then it makes that the kind of overall number of deaths that we expect a lot lower.
So, well, as far as overall numbers that we expect, what I am saying is I think the most accurate metric as far as what we should be using for people to sort of assess their risk, because a lot of this was, oh my gosh, we're seeing at one point they said a 10% mortality rate, then a 5%, then a 3%, and now like, well, we don't know the mortality rate.
6:54, and I haven't been mentioned.
But they predicted 2.5 million deaths, then a minimum with social distancing, which wasn't supposed to have kicked in, 100,000 to 240,000, and then 60,000. The overall, and I think especially when comparing it across countries, the most accurate that we have is the per capita death rate. Here's why: because you eliminate more variables in the sense that, all right, you go to per capita, right? So that matters.
I guess, I mean, I don't, if he doesn't really mention me, I don't know about even watching this, but I guess you know, if you tricked me into showing Ben Shapiro and Steven Crowder, I think most of my audience already sort of has a good sense for them. So I guess, I don't know. I guess it was just a joke from Rat Cracker. I don't know. If we got the time code wrong, just let me know. Daniel Krieger says official oil prices super chat. Yes, big oil price discussion coming up tomorrow. Zachary Foster says, my best friend is in med school at Boston U. Says there was a study of 400 homeless in Boston. All those tested positive were asymptomatic. What are your thoughts? Haven't seen the study, but the asymptomatic stuff seems to be very, very, very serious. Rat Cracker says, when are you going on Joe Rogan's podcast? Announcement soon, I guess. Announcement soon. Samantha, and by the way, I've been on. You can see my appearance that I did already. Samantha Sabatino says, Pence will not be missed. You could even mute Trump's planned remarks for all I care. I just care about the nastiest of the questions. Thank you for streaming. My pleasure. My pleasure. Okay. Let me do a couple things real quick. First, just a couple of new member thank yous. Paul Delaney is new member number 1 today at joinpacman.com. Thanks, Paul. Maureen Zormeyer is new member number 2. Missy Gutierrez Kaufman is new member number 3. Diane Pichatka is new member number 4 at joinpacman.com. And Chuck Niler, or Chuck Niler, Neil Niler, is new member number 5 at joinpacman.com. I'll say a little bit more about that later. Okay, let's get to a couple of other things. Judge Jeanine over the weekend gave maybe her most unhinged performance yet on her Fox News program. We understand people are dying, but what about the rest of us?
Sheltered in their homes who've been patiently watching this unfold have seen the data, and the facts change from day to day. First, there were 2.2 million who were supposed to die in the United States, and then it was 1 million, then it was 500,000, then 250,000. And supposedly mitigation was already taken into account.
Now, that's not true. The 2.2 million is if no one did anything, which no president could get away with just simply saying we're not doing anything. So that's a lie.
Numbers. But the models, folks, are just plain wrong. And today, a potentially lower death rate. And we understand there are still many sick and dying, and density in hotspots are to be treated differently. But what about the rest of us? We want to go back to work.
Well, she's working, first of all, and the rest of us hopefully get to live, Judge Jeanine. So we'll have full coverage of that unhinged rant tomorrow. This is more stuff. Oh, she brought on a protest. I'm not even going to play this for you now. She brought on a protester to praise the protester and talked about how proud she is of the protester. It's really, really crazy. So there's that. Trump supporting the protesters, tweeting, as you can see here, let me zoom this in, liberate Minnesota, liberate Michigan, liberate Virginia, and save your great Second Amendment. It is under siege. If you want to cause violence, then you tell Republicans that someone's trying to take their guns. That's a great way to get people going absolutely crazy. Then here is Donald Trump triggered by a female reporter asking real questions. Trump does the misogynistic trifecta. He says, who you with? Who do you work for? That's number 1. Number 2 is telling her to relax and calm down. And then number 3 is telling her to lower her voice. Notice that he never answers the question, by the way.
That you should have warned them the virus was spreading like wildfire through the month of February instead of holding rallies with thousands of people. Why did you wait so long to warn them?
Who you with?
And why did you not have social distancing until March 16th?
Who you with?
I'm Weijia Jiang with CBS News.
So there's number 1, the whole who you with thing. Mitch McConnell did that recently to a female reporter as well.
If you look at what I did in terms of cutting off or banning China from coming in.
Chinese nationals. But by the way, not Americans who are also coming from China.
Nice and easy. Just relax.
Okay, so there's that's so patronizing. Nice and easy. Just relax. And then it continues.
We cut it off. People were amazed. These gentlemen, everybody was amazed that I did it. We had 21 people in a room. Everybody was against it but me. Dr. Fauci said, had I not done that, perhaps tens of thousands, and maybe much more than that, people would have died. I was very early, very, very early. And we just saw, you saw Brett Baer making a statement. They had a debate well into February. And not even mentioned, it wasn't even mentioned, the Democrats. We were very early. Oh, I'm the president. And you know what I just did? And you know what I just...
And by the way, when you issued the ban, the virus was already here.
Okay, and you know how many people, when I issued the ban, how many cases of virus were in the United States when I issued the ban? Do you know the number? No, how many cases? Remember I said one person. How many cases were here when I issued the ban?
But did you know?
No. You have to do your research. How many?
I did my research. On the 23rd of March, you said you knew this was going to be a pandemic.
Can I tell you what? I did know it. I did know it. All I have to do is look.
So you knew
Anybody knew it. Just, are you ready? How many cases were in the United States when I did my ban? How many people had died in the United States?
Did you acknowledge that you didn't think?
Keep your voice down, please. Keep your voice down.
Did you
Keep your voice down. So then anyway, it's the trifecta. And we know Trump doesn't really know how to relate to women. This is why he's had to pay a lot of women $100,000 after having sex with them. Like, we know this is not a guy who relates to women in the way that many of us do. So there's that. We'll have a clip about that later today. Here is Dr. Fauci schooling Laura Ingraham about how, viruses work. It's crazy that he still has to even answer questions like this.
We don't have a vaccine for SARS. I mean, they got close in mice. We don't have a vaccine for HIV, and life did go on, right? So the idea that we're definitely going to have a vaccine, we didn't really approach much else in the same way as we're pegging going back to normal with a vaccine, did we?
Well, no, but Laura, this is different. HIV/AIDS is entirely different. We don't have a vaccine for HIV/AIDS, but we have spectacularly effective treatment.
Now, the other thing about HIV is you can't go to work and sneeze and give 10 people HIV. Seems worth mentioning, right? That is, why are we even talking about HIV? Because the spread of it is completely different.
People who invariably would have died years ago right now are leading essentially normal lives. SARS is a different story. SARS disappeared. We developed a vaccine. We were in the process of going through the various phases. We showed it was safe. We showed it induced a good response. And then SARS disappeared. And we didn't need to develop a vaccine for SARS. So I think it's a little bit misleading maybe to compare what we're going through now with HIV or SARS. They're really different.
But we don't know. This could disappear. I mean, SARS did pretty much disappear. This could as well, correct?
Yeah. Anything could, Laura.
Oh.
Transmissibility of this is really unprecedented in anything that I've seen. It's an extraordinarily efficient virus in transmitting from one person to another.
Yeah, it took like 3 months for China to get 5,000 cases of SARS. It didn't take 3 months this time around. So anyway, I don't actually think Laura Ingraham is that dumb. She has, she has a degree from Dartmouth. She has a Juris Doctor. She's a lawyer. She went to law school. She's not actually this dumb, I think. It seems to me that she just is sort of playing along with what Fox News has determined is going to be their perspective or their positioning on this at this point in time. We're standing by for today's White House coronavirus press briefing. We've decided we are going to be muting Mike Pence, that his participation is superfluous and meaningless, in fact, and actually aggressively negative in many ways. So we'll be muting Mike Pence when he comes up. I am able to be, I actually am hosting a debate tonight via Skype, which is not going to be live, but we need our equipment to record the debate. I'll tell you more about that later. So I'll stay as long as I can, but when I get the thumbs up that the guests are ready for the debate, I'll have to end my stream. I can't stream and do a debate at the same time, but I should be here for the bulk of it today. Let me say some thank yous to fantastic people on Twitch. I want to say thanks to Nikki206, who has subscribed with Prime, and Nug Wrangler has subscribed with Prime for 8 months. Okay. Remember, if you were watching on YouTube, I so much appreciate everybody hitting the like button and the subscribe button. That really helps us out. Some super chats that are coming in. Let's see here. Zach Bushman. Whoa, hold on a second. Zach Bushman says, friendly reminder to launch a Trident II ICBM nuclear strike on the like button and catch the subscribe button in the blast radius. Yes, I couldn't say it better myself. Lisa Kleinwart says, the weekly chip in to thank you for helping us to bear this insanity. Thanks, Lisa. Young, Dumb, and Baroque says, hey, David, just wondering, where do you land on the great simp debate between Rei, Asuka, and Misato? Choose wisely now. You know, I don't know anything about Garfield comics, so unfortunately I wouldn't be able to answer that. JR says, when I hear my computer sound the alert that you will be starting your stream soon, it's like a doorbell ringing announcing the visit of a welcomed and trusted friend. Come on in. That's such a nice thing to say, Jay. I love that. I appreciate that. Panda Man says, hey, David, can you send me some of your pubic hair so that I can preserve the DNA of the second hottest news commentator? You know, I don't know why you need to go for second place. Just go for your dreams. Go to whoever is your number one. Porthole says, which party is a death cult and why? Come on. You guys know the answer to that. Anthony Stark says, why is nobody talking about the second wave or the pandemic? Of the pandemic, is it canceled? I've been talking about the second wave. That's all I can tell you. Unknown Prodigy says, when are you having another chess tournament? Soon, maybe later this week or possibly next week would be my my best assessment as of right now. Oz says, Kentucky saw a dramatic spike in COVID cases after protests. Do you think we'll be seeing more in the following weeks? Yes. And I'm going to talk about the Kentucky situation tomorrow for sure. Ratcracker says, will you debate Kyle Kulinski over voting Biden? I don't know. Everybody knows my perspective. I think that such a debate could only serve to further divide the left, and I don't want to do that. I want to remove Trump. Alms has subscribed on YouTube. Daniel Rivera says, what are your thoughts of people looking at the 22 million lost jobs and blaming the lockdowns and wanting to reopen the economy as a result of that? Well, I've talked about that so much today, and I have multiple clips coming out about that today that I'm going to forego going into that right now. Ratcracker says, please do a response to Steven Crowder's video. I don't care. I don't care about Steven Crowder. You tricked me already getting me to put on one of his videos, but I don't care about Steven Crowder. John Howell says, support independent journalism. Thank you, John. Metchet has subscribed. Michael Henkley says, David, what keyboard did you end up going with? For now, I just put new batteries back in my standard Dell wireless keyboard. It's a completely beta keyboard. In fact, I'm risking my reputation as a Chad by even admitting that I have this keyboard. In fact, here, okay, it's gone. I got rid of it because I've been told you never want to admit that you have this keyboard. But I am looking at, see, here's the thing. I don't know that I should have a mechanical keyboard for a live stream because aren't they incredibly loud? That seems like it would be a real problem. I don't want to be, dealing with that. Okay, let's see here. Other super chats coming in. Julie Chowdhury says, just sprinkle pixie dust and make it disappear. Ben Rowan says, your lover Kyle Kulinski won't vote for Biden. How do you feel about this? Come on, guys. Come on. Andrew Stewart says, your best nasty but fair question for Trump. I don't know. If I was really in a position to ask Trump questions, I would give it more thought than just, a spur of the moment answer to a super chat. Pedro Guzman III says, while I am on the right wing in terms of political position, I enjoy your opinion because it's the closest to reality the left can produce as possible. The left didn't produce me, my friend. My parents did. Oh boy, more of these spam calls coming in on my phone. Nunez says, beta soy boy keyboard, LMAO. Yes, I apologize. I apologize that my keyboard is so very beta. What can I do? We are anticipating that we are just a few minutes from the start of today's White House coronavirus press briefing. I want to invite you, the best way, by far the best way to support these streams and everything we do is to grab a membership at joinpacman.com. It doesn't take a lot. It doesn't take a high level of technical skill. It doesn't take a long time. It's just a handful of clicks. The website is joinpacman.com. We have suffered a setback, I would say, in the world of independent media. Whoa, this guy's right in my face. That's distracting. In the world of independent media, as a result of the virus, we lost 389 members in March. We were down about 120 in April because we're all in this together. And those folks that can't afford membership anymore, it's fine. We're here for you. We're doing the streams, we're doing the content. But if you are in the boat of someone who can afford a couple bucks a month and you reasonably like me, if you don't like me, you just, troll on through and go right on. If you reasonably like me and you value what we're doing and you can afford a couple bucks a month, consider getting a membership at joinpacman.com. The coupon code over my head 2020 now will save you 66%. That discount is illegal in some of the southern states. It's too big of a discount for independent media, but we're based in Massachusetts and thus it is allowed. And I will thank every single person who grabs a membership. I want to say along those lines, thanks to LC Messman, who is new member number 6, Andrew Lewis, who's new member number 7, Francisco Barbosa. In Argentina, we'd call you Paco. Francisco, often nicknamed as Paco, number 8 today. And I believe that catches me up. Yes, I believe I'm caught up. So that is my appeal to you today. Ignore it at your pleasure, as I always say. But I do appreciate everybody who's been supporting. Let's see here. Other super chats coming in. Where did I leave off? Okay, Daniel Rivera says you can get those keyboards with silent hinges. I could get a mechanical keyboard that is a quiet mechanical keyboard. All right, very good. I'm learning as we go here. Robin Anderson sends a super chat. Lee Douglas says, how is your girlfriend doing? Much love to you both. She's doing fine. Thank you. Sarah S. sends a super chat. Panda Man says, my number one hottest is Pat. Oh my goodness, we have a Pat fan in the super chat. Ben Quentis has subscribed, as has Jeannie Hunt. Stephen Jackson says, these briefings don't seem to ever start when scheduled. Has that been the case in previous administrations? I don't actually know under previous administrations how typically they started late. Thanks to Barry Steinberg for subscribing. Also, Shep7 says, we're smoking a fatty together after this, right, Dave? I certainly don't smoke anything. Very bad for your lungs, puts you at additional risk for a serious case of COVID-19. Certainly no smoking for me. A couple of people asking, what do I have going on? Not much really. I did bike on Saturday. I wore a mask and a face shield and a beekeeper's outfit, so I was relatively well protected. I ordered an espresso scale, so that's coming in tomorrow, and I will be now. I'm so going stir crazy that I'm going to be weighing espresso down to 1/10 of a gram. Can you imagine? More ridiculous behavior than weighing out my espresso? No, but in all seriousness, I've got a great espresso machine, and I've never learned to really use it manually. I used pre-measured shot volumes, and I am now going to be, I'm moving on, and we will be weighing everything down to 1/10 of a gram, my friends. Oh, and also I got a cubic yard of soil delivered today, and I will be planting all sorts of vegetables in the next couple of days. I've got radish seeds, I've got carrot seeds, snow peas. What else? I guess that's it. I'm growing some stuff indoors as well, and I'll transfer it outside around Mother's Day. That's all I've got going on. I wish I had more. Okay. Charlie says, David, what's the current cost to like this stream? It's free. The likes are free. So much like the bans are free, we just hand out bans. It costs us nothing as people require bans. You can also like the stream for free. I don't know why I do a whack-a-mole motion for liking the stream, but like the stream and make sure to hit that subscribe button. Let me say a huge thank you to Waken Bacons, who has just subscribed with Twitch Prime. over at twitch.tv/David Pakman. Very exciting stuff. What else? Brody Andrew Mulligan says, in Texas, your discount equals jail. Que lástima, Pedrito. Yeah, a Pedrito. I don't know that we need an accent over the O, Brody. But yeah, in tech, we can't even offer a 66% discount in Texas. Greg Abbott would personally arrest me and put me in a cage if I were to do that. Joseph Ernst says, are the Republicans setting DeWine up for a presidential run at some point? Maybe. Not a totally crazy candidate to imagine. Danny Thompson says, I sent a super chat to you the day you mentioned picking up painting again, about thinking of you in Bob Ross hair, painting happy little trees. You made my weekend when I saw it come to life on your Facebook feed. Yeah, on our Instagram and Facebook feeds, we put up a picture of me photoshopped onto Bob Ross. Danny, if you are the source of that Photoshop, then thank you for creating that. AC says, hope all is well. I gave up coffee, so here's the $5 I would have spent. Thank you. I don't know if that's for real. Micah Gelfand says, where can I send you some edibles? No need to damage your pretty lungs, David. Do not send any drugs through the mail. We have reason to believe that our post office box is being very closely monitored by authorities that seek to take down the David Pakman Show, and we don't want any drugs showing up at our P.O. box. I'm mostly kidding about that. Okay, let me say thank you to a few other people here. Where did I leave off? Okay. Trevor Patterson is new member number 9 at joinpakman.com. Victoria Zhang is new member number 10 at joinpakman.com. Michael Mills is new member number 11. Hung Lung Yang is new member number 12. Linda Monaco is lucky 13. Scott Gore, you are new member number 14 today. Whoa, something just went haywire on my end. I want to say thanks to Sherry Wright, who is new member number 15. Brian Dominguez is new member number 16. Also, thank you to Jurgen Rydell. Jurgen Rydell is number 17. Marcus Reese Harris is new member number 18. Melanie Branov is number 19. And Fiona, is it Fairclough or Fairclough? Fairclough? Is new member number 20 today. Lastly, Andrew Garibay is new member number 21. Very much appreciate the support. Very, very much appreciate it. If you're just joining us, we should just be minutes from the start. A couple of announcements today. Number one, I have to go and moderate a debate in a little over an hour. So I'll stay as long as I can. At a certain point, tragically, we will probably have to prematurely pinch off the stream because I have to go moderate a debate using all the same equipment. So I can't be streaming and moderating a debate at the same time. But hopefully we'll get to most of today. We will also be muting Mike Pence. I've determined that his contributions are not only of no value, they are acutely frustrating and they make me nauseous hearing him talk about, you know, the air bridge. We've scheduled flights and we've got millions of masks. It's just of no value whatsoever. So we will be muting. We're going to drop the mute on Mike Pence a little bit later. Let me say thank you to Glorious Esteban for subscribing with Twitch Prime and New York Jailhouse, who has also subscribed with Twitch Prime. Super chats continue to roll in. Ratcracker says, as a libertarian socialist, I've been doing a lot of research on harm reduction versus accelerationism for capitalism. There are very few good arguments against harm reduction. Where are you in this debate? I am on the harm reduction side, squarely, very, very squarely, very strongly even. Joseph Vanscoy says, would a Warren VP nomination get apprehensive Bernie bros on board? It would get a fraction of them on board, but not all of them. Daniel Rivera says the people want more Pakman coffee videos. Yes, I will be doing more espresso videos as soon as my espresso scale comes in. Matt Chavez says protesters have unprotected kids with them. Is that child abuse? It's certainly neglectful. Certainly neglectful for sure. Magic XB says, what are your thoughts on Georgia removing restrictions on 424? Seems absurd that these southern states place the economy over health. I didn't see that Georgia was doing that. I saw that Texas and South Carolina were. But if Georgia is, then we will certainly research that. But it seems very premature. Anna Burgos says, have you bought any stocks or had your eye on any? You know, I have not bought any stocks for, I made most of the buys I'm going to tell you about today. And remember, we're killing time here. Let me turn up the audio so that we don't miss when this starts. We're just chatting until this starts. Here are the stocks that I have bought since the start of this, but everything's been at least a month ago. I bought Zoom, ZM. This has gone, where has it gone? I bought everything. I want to say it was right around, man, when did I buy these? Does anybody remember? Because I said when I bought it. I think it was right around here. I don't know. I'm up somewhat. Yeah, I think I was in around 136, something like that. So I bought Zoom because it seems a lot of people are going to be using Zoom. I bought Roku. I've owned Netflix for years and years, so it didn't seem like I didn't buy more Netflix, but I think it was right around March. Yeah, right around here. I bought Roku right around here, so that one's doing well. What else did I buy? I did buy some Bayer on the idea that maybe chloroquine would be effective. So I bought right around March 20th. It is up about 20% since then, but it doesn't seem like hydroxychloroquine is going to be the thing, certainly. I bought it before Trump started talking about it. Let me put it that way. I did buy Live Nation. My idea with Live Nation was they're going to get crushed in the short term as they have. I think right around March, mid-March I bought. But at some point, live events are going to be a thing. So that was the idea. Shockingly, it's actually up. If I was in at 29, it's at 36 now. And there was one other stock I bought, although I don't remember now what it was. Those are the moves. And again, as I've said before, I think that, I don't think I'm good at picking stocks. I think very few people are good at picking stocks. I mostly have mutual funds, very broad mutual funds, total stock market index, total global stock market index. But, that's it. And then as many of you know, famously, I have had Tesla stock for a very, very long time. And I've had Amazon and Netflix stock for a very, very long time. Sirius XM Radio, I think, is the only other stock I have. Okay, let's see. Let me thank a few other people. Now we're getting into some complicated names here. Let me see if I can pronounce these. Oh, dear. Christopher Kiamenaiwa. Oh, boy. Is new member number 22 today at joinpacman.com. Whoa, something went wrong there. Number 22. Lisa Koziel is new member number 23 at joinpacman.com. And Lucinda Hansen is number 24. We are just shy of our goal of 25 as Dr. Birx has entered the room. I'm increasingly lukewarm on Dr. Birx after some of the whoppers she's mentioned. The fact that the TVs are on is not a good sign. It suggests there will be propaganda. Erythropathac says, is Biden to progressivism as Bieber is to music? I don't know enough about Bieber to say. Vintage item? Oh, vintage item store. I see. Trump red states to reopen suppressed Dem voting. I'm not sure exactly that I'm parsing that correctly. I apologize. Where did that go? Adrian Benningfield says, David, if you reach a certain membership goal, an idea could be you reading Animal Farm, if legal, in videos could be great. I'm not sure if the audience wants to see me read Animal Farm. I don't know that would do well. I think that may even get me to see cancellations go up. That's very scary. I don't know if that's a good idea. Bruce Robinson says, why is it that liquor stores are essential but recreational marijuana is non-essential and not available? I thought here in Massachusetts, recreational. Yeah, that's a good question. I don't know the answer to that. It seems a little incongruous. Omegaya says, hey, David, when you're trying to convince some to vote Biden, remind them of A.G. Barr. He might just start rounding up secular humanists who talk too much. Okay, here is Trump. Let's switch over to, okay, we'll switch over in a little bit. Hold on.
Following the release of our reopening guidelines, governors across the country are looking forward to phase one and announcing plans for an economic resurgence. We're going to have a resurgence.
Okay, I'm going to switch to C-SPAN because, as you know, they have better audio. It's on a 10-second delay, better audio, though, and they show the reporters asking questions. Thank you.
Thank you. Following the release of our reopening guidelines, governors across the country are looking forward to phase one and announcing plans for an economic resurgence. We're going to have a resurgence, too. At a time when millions of American workers and families are struggling with the financial consequences of the virus, it's critical to continue the medical war while reopening the economy in a safe and responsible fashion. During this time, Americans must maintain strict vigilance and continue to practice careful hygiene, social distancing, and the other protective measures that we have outlined and that everybody's become very familiar with. We continue to be encouraged that many of the areas hardest hit by the virus appear to have turned the corner. For example, recent deaths are down very, very substantially. You can compare that with their peak not so long ago, and you have numbers.
Fact check, we've got a plateau in some places, southern states climbing rapidly.
It's down by over 50%, congratulations. And in New Orleans, where they've done a terrific job, they're down 65%. 30 states have just one case or less per 1,000 people, far fewer cases per capita, as an example, than Germany, the United Kingdom, France, Italy, Ireland, Switzerland, Singapore, Belgium, Spain, Norway, the Netherlands, Austria, Sweden. My administration continues to press Congress to replenish the enormously successful Paycheck Protection Program, which has impacted 30 million American jobs. We hope to have
tons of small businesses unable to get any money and likely will fail permanently, sadly.
A lot of progress has been made on that, tremendous progress. It's a great plan. It's a great plan. It's helped a lot of people. So we hope to have a vote maybe tomorrow in the Senate. And based on the record low price of oil that you've been seeing, it's at a level that's very interesting to a lot of people. We're filling up our national petroleum reserves, the strategic reserves.
This is a real sham. So for weeks, Trump has been saying the price is too low. We've got to raise it, working with Russia and Saudi Arabia to raise it. Now that clearly it's beyond his control, he's going to act like it's a good thing, despite previously acting like it's a bad thing. We're talking about a total con man here.
We're also pushing for the deal to include an additional $75 billion, our deal that we're talking about. $75 billion for hospitals and other healthcare providers. Many providers and their employees have taken a huge financial hit in recent weeks, and visits, elective procedures, surgeries, et cetera, were canceled. We think that they can all get back online. They'll get it done. The hospitals have really been fantastic. The hospitals,
many places not doing that.
They've stepped up to the plate. They've really done a great job. We appreciate it so much. For areas less affected by the virus, we've issued new recommendations about how to safely resume elective treatments. HHS has also distributed the first $30 billion in direct payments to 1 million healthcare providers across the country. We've also invested $1.4 billion in community health centers to ensure our most vulnerable communities, including many African American and Hispanic American communities, have access to the services and testing that they need. Earlier today, Vice President Pence spoke with governors from all 50 states about our unified effort to defeat the virus. He had a great call. It was a great call,
Perfect
very
call.
positive in, I'd say, every way. Prior to the call, we provided each governor with a list of the names, addresses, and phone numbers of the labs where they can find additional testing capacity within their states. Many, many labs. We're providing you with a list. We'll show it to you now if you need it. We'll give you the details. But hundreds and hundreds of labs are ready, willing, and able. Some of the governors, like as an example, the governor from Maryland didn't really understand the list. He didn't understand too much about what was going on. So
This is the new shifting of blame on lack of testing from the federal government to governors, just as a heads up.
his capacity, and we hope to be able to help him out. We'll work with him and work with all of the governors. Similar to the situation with ventilators, states need to assess their complete inventory of available capacity. Some states have far more capacity than they actually understand, and it is a complex subject, but some of the governors didn't understand it. The governor, as an example, Pritzker from Illinois, did not understand his capacity.
He didn't get it. Yep.
Not
Can you
simply
imagine?
ask the federal government to provide a
Imagine if during a pandemic, Obama listed governors who just didn't understand.
you have it, but we are there to stand with the governors and to help the governors, and that's what we're doing. And they have a tremendous capacity that we've already built up, and you'll be seeing that. We're going to be introducing a couple of the folks in a little while to talk about it. I want to draw your attention to Governor Cuomo's remarks during his press conference today. He said the president is right. The state's testing is up to the states to do, which will implement the tests and logistically coordinate the tests. We have about 300 labs in New York, and they're great labs, actually. And it's my job to coordinate those 300 labs. I think the president's right when he says that the states should lead, and the governors they're really getting it together in New York. A lot of good things are happening in New York, and I think the governor's going to come in to see us tomorrow. He's coming to the Oval Office tomorrow afternoon,
Is that a good idea for Cuomo to do?
coming in with some of his people. So we look forward to that. Some of the articles that just recently came about, if you remember, and I put out a statement today, for a month it was all ventilator. That's all people could talk about was ventilators. And we did a great job with that. We built a lot of ventilators, to put it mildly. We have so many now that at some point soon we're going to be helping Mexico and Italy and other countries.
It doesn't actually seem like we have that many. It seems many are in production.
They were not in a position to build them themselves. But we have thousands being built. Every state they have the ventilators. If they don't, we have almost 10,000 in our Federal Reserve, our stockpile, as they call it. And we did a great job with the ventilators. Unfortunately, the press doesn't cover it, other than the fair press. But so then you say, gee, they need ventilators. We don't need ventilators.
Not the fake news, though.
That's under pressure we did that. Nobody that needed a ventilator in this country didn't get one.
I believe that's
And a story that just came out, how the media completely blew the Trump ventilator story. I'm sure you'd love to see that. That's by Rich Lowry, respected journalist and person. How the media completely blew the Trump ventilator story, which unfortunately it did. And here's another one that just came out. Kyle Smith, the ventilator shortage that wasn't. The ventilator shortage that wasn't, because we got it fixed. And we're also going to help the states, by the way, stockpile ventilators. So if a thing like this should happen again, they've got them.
Imagine Obama did.
The stories on testing are all over the place, that we're actually in good shape. I'm going to have the vice president and others speak to you about that, but we're in very good shape.
We'll be muting that.
On testing, and we're getting better all the time. You're going to see some interesting things. I thought before I went any further, though, I'd like to have General Semonite, who's done an incredible job, tell you where we are. You know, we're still building beds in hospitals for people that need them. I guess the hospital business, General, is getting pretty much closed out now, but we're creating a lot of space for people just in case, and in some cases they probably will be using them. But I thought the General, he's been so impressive and done such a great job. I thought on behalf of the services and on behalf of the federal government, he'd say a few words about what we're doing right now. Thank you very much, General.
Well, thank you, Mr. President. Just want you to know that on behalf of all of us in the Department of Defense, our thoughts and prayers go out to all of those patients and all those victims that have been affected by this terrible virus. And the President and Vice President talk all the time about the heroes, but I've been out there. I've seen the doctors, I've seen the nurses, and all those that have worked very, very hard. And we're just so proud to be part of this noble calling. For my team, I really made it very, very simple. I said there's 3 legs of this stool, and they all have S's. There's sites, in other words, hospitals. We've got to worry about supplies, and we've got to worry about staff. And so right when Governor Cuomo called the president about almost 30 days ago, he said, I need some help worrying about what could be tens of thousands of hospital room shortages. So the president and Secretary of Defense asked us to fly to Albany with a team. And on the way up, we understood how complex of a challenge this was. And we knew there's no way you can solve a complex catastrophe with a complicated solution. We needed a very, very simple solution to be able to then work with HHS, to be able to work with FEMA, to be able to work with the Vice President's task force, and then to be able to power this down all the way down to the local level. Some of the governors asked us to try to build a hospital in a parking lot or a field in 2 or 3 weeks. You can't physically do that. So what we said was, let's go to where there's an existing facility. And I'm going to kind of make this in 2 big pots. Those that are either hotel rooms or college dormitories, smaller rooms, or those that are in real large areas like field houses or convention centers. And we designed those standard facilities that could be either non-COVID or COVID, and then we got that approved here at the federal government to be able to then power that back down. So we went to Governor Cuomo, and he said right up front, I love the concept, I need you in the Javits Center, I'm ready to start having you work tomorrow afternoon. So when we flew back that afternoon, the next day, we basically built this standard design and then continued to be able to power it down all the way down through the rest of the team. So I just want to show you a couple slides here, and we'll kind of let you know where we're at right now, Mr. President. We had to do a bunch of assessments. So somewhere in the order of over 1,100 different locations we went to, and we worked for FEMA, we worked for the president, and we worked for governors and mayors. And we said, what do you think your demand is going to be? And based on a lot of the modeling that's been in this room here.
Notice how they're always talking about, like, this is not actually the issue. This is delightful, and we're thrilled with beds. Of course, we need beds, no doubt. But the issue right now mostly is testing. The issue is protesters that are going to be super spreaders of the disease. So it always feels like they're talking about the thing that they should have been talking about 10 days prior.
Complete, and in the next week and a half, we're going to complete about 15 more facilities. We've got some pending. Some mayors and governors are still wondering, do they have enough bed space? And what's important here is we need a very agile plan. You can't do something 3 weeks ago and think that this is going to continue to stay, because this virus gets a vote. And this entire team, the federal government, has tried to be as agile as they can, supporting those states and those governors. The beauty of the plan, though, is it doesn't have to be built by the United States Army Corps of Engineers. So we designed about an extra 52 facilities. We gave those to the governors, and I've got to be very, very laudatory to the governors. They then imposed and put a lot of those on the ground and did those themselves. So let's go to, I'm just going to show you some real simple pictures here. Go to the next slide if you don't mind. So this is an example of the Javits Center, and you've heard the president talk about it quite a few times. This one, about 2,100 bed spaces.
This is what we call filler. Like, the pictures of the Javits Center on April 20th are not newsworthy. It's a beautiful facility. I love that they have the beds. It's great, but we saw this a month ago, right? It's very weird. Maybe not a month. Okay, don't take me literally there.
Central oxygen. So everybody has oxygen right behind their bed to be able to take care of those patients. And again, built this one, about 1,000 patients treated. Let's go to the next one. I was up in Detroit with Governor Whitmer, and she walked us through and told us her intent. Here's where she needed to do this in the TCF Center. You'll see all the cubicles that are laid out. This is right in the middle of a convention floor where there might be like a boat show or a car show, and then went in and built 970 different capabilities there. And again, a lot of great work by my guys in the Corps of Engineers and the rest of the mayors and the city's team all pulling together. Let's go to the next one. This is called the McCormick Place. Governor Pritzker sat us down. He said, here's kind of our intent of what you want to do.
Making me nervous,
Mayor Lightfoot walked us through, and we went into another large convention center. This is actually 3,000 bed spaces, a very, very large build, and got this one done in a relatively short time. And then here's another one that kind of helps you understand the dynamic here. Go to the next one, please. This is in Miami Beach, and I flew in to see Governor DeSantis. And my guys had kind of scoped out about 450 beds, and he said, Todd, how long is it going to take to build this? And we kind of said probably till the 27th of April. And he went to his health people and he said, how long do you need? And they said, the day we need this is the 21st of April. And I told my guys, you don't have till the 27th. Figure out how to get it done by the 20th. This is where you don't get to build to be able to have the perfect solution. You got to be able to get the mission essential done. Lives are on the line here, and we've got to be able to get everything done to be able to save those lives. And let's go to the last one here. This is one we're doing right now, Colorado. This is in Denver, another gigantic convention center. You'll see all the different cubicles here to be able to just bring in that oxygen, 6-inch copper pipe that comes in, and it's all piped throughout the entire convention center.
Awesome pipe.
6 miles of pipe that's able to go in to be able to make that happen. And in closing, I just want to be able to say that we are very, very focused in the Corps of Engineers getting this done. But this is all about the team, the federal team, the state team, the local team, the vice president's task force, and a lot of the people sitting here have informed us of how fast we need to go. And it goes back to, again, all the governors and the mayors that make this happen. But I want to reiterate, President Trump has called me 3 times, and Secretary Esper has been on the phone at least one of those times and said, what else do we need to do to set you up for success? Is there any other knobs we can turn to be able to help you go? And you think about that equation of those 3 S's, I think that with the federal government and the mayors and the cities here, we've effectively taken that first S out of the equation. And so I can't tell you, of all the things I've done in my career, this is a noble calling to be able to step up and save American lives. So with that, sir, I thank you very much.
Fantastic, Jeff. Thank you
Wow.
very much. Anybody have a question for the general?
No question. Don't ask him any questions,
Anybody?
please.
Because I think it's very self-explanatory. It's done an incredible job. Jeff, do you have a question?
Are there more projects, sir, beyond the ones that you've just identified that you'll be working on?
So about a week ago, we thought we were about capped at 26. What we're seeing is, and I said the virus gets a vote, we're seeing some of these curves are stretching out where we might have thought we only had 5 or 6 days. We actually have a couple weeks now. Other ones we're seeing exactly the opposite. So where we didn't think there was some, and I'm not going to go into locations here, but we are definitely get requests in. We've got 6 more requests in just in the last 4 or 5 days. They're a little bit smaller facilities and more remote areas, but our job, if we have enough time to go build, we want to get in there, do the assessment. We work for the mayor and the city and the governor here, and we can still get them done if the mayors and those elected officials make a fast enough decision.
You might say while you're here, we're building, the general's in charge of the wall on the southern border. And we want to build 450 miles of wall, and it's very much under construction. You might give them a little bit of an update. How are we doing with the wall?
So, sir, I think the most important thing, and you stressed this, and Secretary Esper stressed this, there's really several different priorities here. Our number one priority in Department of Defense and the Corps of Engineers is to protect the team, protect the force. No matter what we do, we've got to continue to take care of our civilians and our service members out there. And so every single thing we're doing, whether we're building for the VA or we're building for civil works projects or for the Department of Defense or building on the southwest border, we are going out of our way. I talked to my commanders this morning. We've got over 4,000 contractors that are on the ground out there, and we've had no positives as of this morning, knock on wood. Same thing with my 400 employees. We're testing them, not necessarily with a more stringent test, but with temperatures to be able to make sure that everybody's safe and everybody goes out of their way to do things the right way. Construction is going very, very smooth. What we're seeing is our contractors are extremely focused. Now that we've got a good, clear path, both on the CBP program as well as some of the DoD program, we are, I think, very well postured. It's a very, very aggressive build, but we're well postured to be able to meet your expectations, sir, of 450 by the end of December 2020.
And we're over 160 miles.
164 as of today, sir.
164 miles, and we'll have it done sometime pretty early next year. Very exciting.
Yes, sir.
And you might
Understand
just say
that he promised a wall across the entire southern border. Now, when he talks about having it done, he's no longer talking about that. It's just like it never happened. It's a rewriting of history.
A standard design that you trust in, and it works very well. I've got a pat on the back, Commissioner Morgan. He was very adamant at continuing to be able to make sure that it supports his agents. And so we've got a design now that certainly does that. And then we've got a phenomenal contractor workforce.
Is that a design you can hop over with parts from a regular hardware store?
We don't see any significant problems. And I think it's also important to point out that we want to do this the right way. So we try to balance this with environmental considerations are out there. We're trying to do due diligence when it comes to anything to do with any of the citizens who are affected. We're trying to make sure that we're protecting all of the things that we need to protect and try to find that balance where we can both meet the administration's directive while at the same time making sure we're doing this so that everybody gets a vote and everybody has a fair shake.
Yeah, please.
May I ask what you're doing regarding the availability of, at the recreation sites that the Army Corps of Engineers operate?
I think you're supposed to have your nose in the mask.
And whether or not there are restrictions.
So I'm an engineer. I take my guidance from some of these experts sitting on the bench over here. And when the president says turn on America, what we initially did, like many, many other governors, they shut down beaches, shut down cities. I had a meeting with my commanders this morning, and as soon as we think it's safe, turn them back on. I mean, parking out there at a rec area where you're 500 feet away from everybody in a camper is probably low threat. I will continue to take guidance from the administration, but where we get green lights to continue to put our rec areas full up and let everybody go back out there and do things the safe way. I mean, we work for the administration, so I want to do it safe, but I don't want to be the last guy that turns things on. Not at all. Yes, ma'am.
Hi, thanks for walking through some of the efforts. Can you say anything about whether or not there are any specific efforts in communities that are hardest hit, like Black communities or Latino communities, communities of color? Are the Army Corps of Engineers doing anything that would be building any sort of temporary facilities for those communities?
So we basically key off what the city asked for, the city and the governor. There are a couple specific areas that certain city mayors have asked us for. Again, I'm not going to go into details, but we basically, if they go in and say, I'm very worried about a hot spot on this side of town or a specific community here, we will do, and that's what the administration is charged to do, is whatever we can do to be most responsive. We just don't want ever to have an ambulance pull up to the back of a hospital and somebody says, we're out of room, go to the next hospital down. So that's where we're trying to make sure that bed space is available. And so far, everything we built has been ahead of need. In other words, we're able to finish the building 2 or 3 days before it's needed. Thank you, ma'am.
Okay. So you have a choice. You can stay and watch these wonderful people ask us really nice questions, or you can go back to building beds.
Sir, I got a lot of building to do. I'm going to leave if you don't mind.
Thanks,
sir.
Very impressive. That's an impressive job, isn't it? Seriously? That's really great. Thank you very much. He's a terrific gentleman. We have a lot of great people doing that kind of thing that they really have to get recognition for the incredible job they're doing.
Whatever.
Because I don't think anybody else could do it. Nothing like that. And that's on top of thousands and thousands of hospitals. And, he built, just in New York alone, 4 hospitals and 2,900 beds, and got them done so quickly nobody saw anything like it. Fortunately, we haven't had to use too many of them, and that's okay. That's probably better news than having to use them all, right? Because a lot of good things are happening in New York and elsewhere. So through the public-private partnerships and deregulation, the federal government has already made immense testing capabilities available, but some states need to take action to fully utilize it. To date, the United States has conducted millions more tests than any other country. You can add them all up, and they don't catch us. And our numbers are doubling almost on certainly on a monthly basis, but almost on a weekly basis. We're moving very rapidly.
Notice how untrue that is.
At a number nobody thought possible.
Just look at the numbers,
And
guys.
we'll be doubling our number of daily tests if the governors bring their states fully online through the capability that they have. We have tremendous capability out there already existing.
We have the numbers.
And we explained that
so.
to the governor today. Mike and all of the people explained it very strongly to the governors. They really get it now, I think.
So testing has been level for several weeks. It's not doubling every week. It's just untrue. Look at the numbers.
Diagnostic testing to treat patients, as well as contact tracing to contain outbreaks and monitoring to pinpoint potential hotspots during phase 1. And there are some hotspots, and we have them pinpointed, and they can really cover it very, very nicely when they know exactly where to go, and they're being told where to go. And also these locations where they're going, and some of them are federal. Some of the governors didn't realize they were allowed to use federal locations. They are. And we have a booklet of the federal locations. We can hold it up. I think you'll show that. Maybe we'll hold it up now. Yeah, okay, fine. But you see, the number. Thanks. These are all locations where they can go.
Oh yeah, hold it up.
Which is really pretty amazing. This is just one page out of many. Look at this. This is
could be
these are all
anything on those
locations.
pages, right? I mean, it's like what?
5,000 labs. That's
What
a lot of
matters is
locations.
the numbers aren't doubling. We're stagnant.
And they
as
can
we
all.
see.
What is it? 5,000.
5,000 pieces of equipment.
So that's thank you very much. That's more than anybody thought. And it's already there. They have to use it. That's all. They have to use it. Some weren't aware. Some were very much aware. Some weren't aware. My administration also continues to support states with our massive operation to deliver masks, gowns, gloves, and other vital supplies. Admiral Polachek and his team at FIFA are really what a job they've done. And Pete, what a job he's done. They're calling on Easter Sunday to make sure everyone's okay. But they're using detailed data about supply chains to track the deployment of 1 billion pieces of protective equipment through private distributors every 2 weeks. So what we're doing is we're delivering a number that nobody anywhere in the world is delivering. FEMA is working closely with Dr. Birx and the distributors to prioritize supply of resources where they are most needed. We're finding the location that they have to get to that location. We have locations that are very important to get to and get to them fast, and that's where they're going. So we have a very strong priority. This pandemic has reaffirmed the importance of keeping vital supply chains at home. We cannot outsource our independence. We cannot be reliant on foreign nations. I've been saying this for a long time. If we've learned one thing, it's let's do it here, let's build it here, let's make it here. We've got the greatest country in the world. We've got to start bringing our supply chains back. Somebody years ago got this crazy idea, let's build all over the place and let's have parts, let's have a screw for a car delivered and made in a country that's far away.
Sort of like Trump's own idea where all of his products for his various failed businesses came from China and other countries. His idea. I guess it was a bad one, he says.
And I like making it right here in the USA. And I think we've learned a lot about that, and especially maybe when it comes to pharmaceutical products. We've also conducted major military operations providing cities and states with additional medical capacity, and the incredible 1,800 men and women from the Army Corps of Engineers. You just met with Todd. The job they've done is incredible. But we have nurses, doctors, we have experts in every field all over. Spoke with Governor Cuomo, spoke with Mayor de Blasio, spoke with many of the other governors that I'm both friendly, and I think I'm friendly with just about all of them, if you can believe it.
Great friends.
But I've gotten friendly with a lot of them. I've gained a lot of respect for a lot of the governors, both Republican and Democrat, during this process. Some really good people, some really good talent. But we're sending a lot of our medical people, not only our construction people like Todd Semonite, but a lot of our medical people are being sent all over the country to different locations. New York City, New York State, New Jersey. I spoke with Phil today. He's doing a terrific job in New Jersey, but New Jersey got hit very, very hard. Phil Murphy, governor. From the day this crisis began, America launched a scientific mobilization of colossal size and scale. Someday they'll be able to write the true story, because nobody's seen anything like it. The fake news just refuses to cover it correctly, but that's okay. The people are understanding, and that's what matters to me. There are now 72 active trials underway across the United States, researching dozens of therapies and treatments, and another 211 are in the planning stages. They're literally mobilizing on therapeutics and also on vaccines. A tremendous progress is being made on vaccines, and I must say on therapeutics. I mean, frankly, if I had my choice, give me the therapeutics right now, because that would...
Every day he says huge progress is being made on vaccines. It's like as much progress is being made on something that will take a year as you can make in a day, right?
Things that look like they could be an answer, but we'll know soon. Being tested, working out right now. This includes their therapies designed to attack the virus, as well as others that would hinder its replication, reduce the rate of infection, control the immune response, or transfer life-saving antibodies from the blood of recovered patients. And one of the incredible things that we've seen, and Mike and I were talking about it before, is the fact oftentimes somebody gets very ill from the plague, okay, from this horrible scourge, and they get better and they recover. And the first thing they say is, I want to give my blood. That's happened. The doctors have told me it's happened so much. I want to give my blood. I want to give my blood.
Notice he hasn't been mentioning hydroxy for a few days because it hasn't been looking good for a while.
Over the weeks, I think we'll be talking about it in the not too distant future. Johnson & Johnson's very well along on vaccines. Again, the vaccines have to be tested. The therapeutics are for now. But a lot of good things are happening on both. But ultimately, we also hope to prevent infection through a very safe vaccine. And that'll be a great thing when we have that. And we will have that. So with that, I'd like to introduce Admiral Guar and Brad Smith to discuss some of the incredible things that have been done. And they really are what they've been able to do in a very, very short period of time with and equipment. You're going to see equipment that you haven't seen before.
Right.
And if you just come up, Brad, if you guys would come up, you could give us a little display of some of the equipment that we have and
show us
some of the things
cool
that are
products
happening having to do with testing. Because testing is a big word. Remember, it was all ventilators.
Oh.
And the reason it was all ventilators.
I thought he was bringing up a new person, some guy Guar, like GWAR, the metal band or whatever. He's talking about Admiral Giroir. Of course, we know him.
Send them anywhere. We have thousands being made a week, and they're very high quality. And that wasn't playing well. So then they said, testing. Oh, we'll get them on testing. Well, testing is much easier than ventilators. Ventilators are big machines that are very complex, that are very expensive. You need you need a group of people that really know what they're doing. We took auto lines, we took a lot of different people, and now we've done that. But it used to be ventilators. Now it's testing. And I think the Admiral, and I think that Brad will show you some things that you haven't seen that are really very spectacular, having to do with testing. We're way advanced. The list I showed you, these are places you can go if you're in the States. 5,000 different machines, 5,000. They're all over the country. We have international also, but these are all over the country. But you'll see something now that's really eye-popping in terms of what they've done. And they've done this under great pressure. They've come up with things under great pressure that are absolutely amazing. So please, if you would.
By the way, I am seeing the memberships come in, and I'll thank everybody for the website memberships when we have a pause.
President, want to talk about a couple things today, a little bit different than I've spoken about before. Since early March, we've really been focusing on two key concepts for testing. Number one, to assure and expand supplies in the U.S. market. This is really critical because we were talking about really a cottage industry with very minimal suppliers that we were asking to supply over a 2-week period of time the normal production that would be for at least a year. And as simple as a swab is not a swab is not a swab. And we need to be very careful that when we put something in a person and tell them a test result that it's really correct. The second component is to secure sufficient supplies at FEMA during this time of peak disease, where we could alleviate any maldistributions within the state. This is the FEMA process of requesting and sending things out and also supporting outbreaks. So starting in my office many weeks ago, we assembled a multidisciplinary team of really incredible people. The medical side of the equation, which I represent, the laboratory side of the equation, high-tech side of the equation, logistics and operation. And Brad Smith is his day job as director of the Center for Medicare and Medicaid Services, an incredibly important component of our country's CMS system, building the future healthcare system, but has done a really incredible job operationally and logistically in bringing everyone together. We have focused on every piece of the supply chain that relates to testing, down to the most minute detail, and he's going to talk to you about some of that. But that started in the second week of March with starting an airlift, because the only supplier, the main supplier of swabs at that time, was a place in Italy that was completely shut off because of the outbreak in Italy. So Admiral Polubchak arranged Greytail Air Force planes to go to Italy to bring millions of swabs back to Secure. That's just how it started, and it's expanded since then. The second part is we've been really marrying, and this has been the beauty, the logistics and supplies to the overall strategy. Two pieces of strategy. Number one, what is the overall testing strategy? And Dr. Birx has had just an elegant strategy in the past, but even more important in the future, when we make sure we take care of indigent populations and those most vulnerable. So the clinical, the contact tracing, and the monitoring of those who are at most risk. We've also married it to the strategy, and you've heard more than you know about, you wanted to know about it, that a small machine that's point of care is good for certain things, but it's not going to test 5,000 people over a short period of time. So the small machines, the medium machines, and the large machines, and how to contextualize them. And the third thing, before I give it to Brad, which is very important, and it's really critical, is coordinating the research, the epidemiology, and the FDA regulatory process. And why is that so important? When we started 5 weeks ago, if we wanted to test this many people with the technology we had, we would have used about 80% of the strategic national stockpile in PPE just to do testing. We needed an innovation. That innovation was to be able to test out of the anterior nose with a completely different kind of swab. It sounds very mundane, but if you don't do that, you can't get the testing to scale. That allowed us to really go to widespread testing. Last week, moving to polyester swabs, which is going to open up millions of new swabs onto the market. But that's a regulatory science and innovation step that had to co-occur with this. And with that, I'm going to let Brad talk about.
Yeah, just a reminder, guys. I hope all this is true, but looking at tests per day on covidtracking.com, you see that the numbers are not really increasing much at all over the last several weeks. This is just the data. This is just the numbers. Okay, back to it.
Past several weeks to help increase the supply of testing across the United States. As you all know, there's really three parts that you need to make the test work. First, you need the machine, which as Dr. Birx will share more and the president spoke to. We have a very, very large number of those across the United States. It's about making sure that we're taking advantage of them. The second part of the testing is making sure that we have the collection supplies to actually be able to collect the specimen, and I'll talk a little bit more about that. And then the third part is making sure that you have the materials you need to support the machine to ensure that you can actually process the test once it gets to the lab. I'll let Dr. Birx talk more about the machines here in a second, but as you'll see, across the United States, we have a tremendous number. They range in variety. So we have some very small machines that do point of care testing. They may do, say, 50 to 100 tests a day. We also have other very large machines that can do several thousand, process several thousand tests a day. On the collection supply piece, I'll talk through a couple different kinds of collection that can be done. So for the nucleic acid test, which are the tests that are currently being done today, you generally need a swab of the nose. To do that, you need the swab, you need the collection tube, and you also need the transport media that it can be transported in. We have a very large number of swabs already in the country, but we have secured an additional 30 million in production that will be ramping up over the next several weeks. One company located in the Northeast, we're going to be using Title III of the DPA to help them build 4 new production lines. They are currently the largest swab producer in the country, and this will help them ramp up their production tremendously to over 20 million additional swabs a month. A second company located in Ohio is currently the largest Q-tip maker in the country. We're helping them convert their line from making Q-tips into making swabs. They are actually ramping up production starting this week of swabs, and will be ramping up to over 10 million per month. So in total, that's over 30 million new swabs that will be coming just over the next handful of weeks. The second piece is on the collection tubes. The collection tubes, we've been partnering with Oak Ridge National Lab, a Department of Energy lab based in Tennessee. They have very unique and sophisticated injection molding manufacturing capability, and they are in the process of ramping that up to create collection tubes, and they will be ramping up to over 40 million collection tubes a month here over the next several weeks. In addition to the swabs, we believe that as testing progresses, there'll be other types of testing like serological testing that will occur. And those samples have to be collected in different ways. So many times, some of those tests will require a finger prick. So in addition, we've secured over 17 million lancets, which is what you use for the finger prick, so that we have those available, as well as 17 million alcohol swabs, which is what you need to clean the finger before you do the finger prick. In addition, although folks are not talking about this much yet, we also believe that businesses across the country may want thermometers to test folks as they come into the office. And so we've secured over 650,000 infrared thermometers that states and businesses will be able to access to be able to test folks as they come into work. So I think we've made tremendous progress on the collection side. In addition to the collection side, we've been very focused on ensuring that the labs have what they need. To process a specimen in a lab, you really need two things. You need something called an extraction kit, and you need something called a PCR test. In order to be able to fully process a test, you need both of these things. Sometimes these things come together, and sometimes they come separate. For some of our point of care tests, including the Abbott and Cepheid tests, they come together. They are ramping up production rapidly to over 3 million of those tests per month. And these are tests that did not exist even a month ago. The second piece is on some of these large machines. They also sell complex cartridges that come together. One of the big manufacturers is that has already ramped up production from about 1.6 million a month to more than twice that already, and that's already occurred. In addition to when they come together, they also sometimes come separate, and we see significant ramping up of production there from our manufacturers through our public-private partnerships. And we're seeing both several million more over the next few weeks of both the RNA extraction kit as well as the PCR test kit. So with that, thank you.
All right. Well, there you go.
Please.
Oh, no, we're about to mute.
Thank you, Mr. President, and I share your admiration for this remarkable team, from the Army Corps of Engineers to Brad to Admiral Giroir. They're doing a remarkable job every day. As President mentioned, today we had our weekly conference call with governors.
Okay, so we're going to be muting, as I said. This is just the completely worthless part of it. So let me do a few things just so I get caught up. Huge thank you to Lonnie Kratz, who is new member number 26 today at joinpacman.com. Thank you, Lonnie. Also, thanks to, I think I thanked Lucinda Hansen already, but if I didn't, Lucinda, thank you for your support. I got a request from Jacob to say, can you say hi to my mom, Patricia? She watches Fox News every morning. Not good. I balance it with you in the afternoon. Very good. Patricia, Jacob, you have raised a great kid. Jacob knows exactly what is and is not disinformation, and I would take a page out of Jacob's notebook here. Beautiful, beautiful thing to do. Also, Dennis saying hi to Patricia, despite not being me, which is absolutely and completely fine. I want to remind everybody we will be having another David Pakman Show chess tournament either late this week or next week. Of course, all of our viewers on Twitch will be not just invited, but encouraged to participate. I want to say thanks to Ghost Noted 24, who has subscribed for 5 months with Prime and asks me what's my favorite Gwar song. I don't actually know of any songs by Gwar. Also want to say thank you to More Sushi, who has subscribed with Prime, and I really, truly so much appreciate that. Kaylin Brooks asked, hey, David, when did the U.S. officially know it might be a pandemic like COVID? And is it true it was as early as the end of Obama's term? I have no evidence of that at this point in time whatsoever. Incredible TV says, I bigly enjoy your show. Tremendous. Thank you very much. I appreciate that. I also want to say thanks to Kimberly Ray Kendrick. Kimberly Ray Kendrick is new member number 27 today. Thank you so much, Kimberly. I so appreciate your support. And that of everybody who's been watching. A few things to point you to as we wait for Mike Pence to wrap up his daily propaganda and we get hopefully back soon to actual doctors speaking or questions, nasty questions. We have a new clip out about Dr. Fauci brutally schooling not Dr. Birx, Fauci. I'd love to see that. Dr. Fauci brutally schooling Fox News propagandist Laura Ingraham. You can see that on my YouTube channel right now. Also a clip about 35 seconds of absolutely meaningless, incomprehensible drivel from Donald Trump. No dribbling. I have that Michael Jordan documentary on my mind. Drivel from Donald Trump from the Friday press conference, or maybe Saturday, which I believe is beyond English language comprehension. If you check it out, let me know what you think. All of those clips are already out on my YouTube channel. Brian Harvard asks, Star Trek or Star Wars? It's Star Wars for me. I know nothing about Star Trek. I've seen like one of the new Star Trek movies with young Captain Kirk and the other dude playing, this guy. I don't know anything about Star Trek. So for me, it's Star Wars all the way. Year of the Cat says you should compare the press conferences that the Australian Prime Minister does. He can actually put coherent sentences together. Yeah, I've seen a little bit and read that those are very, very good. Daniel Rivera asks MJ or LeBron. So as a person, probably LeBron. It seems that Michael Jordan's treatment of women and gambling issues are not the best. But as a player, absolutely Michael Jordan. I grew up in the Jordan era. Loved every minute of watching the Chicago Bulls win 6 during the 1990s. I look forward to watching the documentary very, very soon. I want to say thank you also to Tyrone Thompson. Tyrone is new member number 28 today at joinpacman.com. And also a terrific person, William Armstrong, is new member number 29. If you're just joining us, nothing is wrong. We have just made, as a group, we've made the decision that Mike Pence adds nothing each day and merely propagandizes as Trump looks orange, sweaty, and swivels at the hips, as you can see. A very, very intense Zoom taking place there on Donald Trump, a scary moment for many, many of us. MK Crisp asks, Better Call Saul or Breaking Bad? I love Better Call Saul, but Better Call Saul is good in part because of Breaking Bad. So it's got to be Breaking Bad for me, but Better Call Saul, tremendous. I'm caught up on season 5, which is airing right now. Excellent show. I mean, just a fantastic, fantastic program. But no, I do believe that Breaking Bad is even that much better, Let me go back and answer a couple of other super chats here. Let's see here. Suffragium says, talk about the USA knowing about COVID since November of 2019. Anthony Lozago says, this guy gives me the creeps. I think you were talking about that first General Semonite or General. Yeah. He was an interesting guy. Mary Allen says, I hope a reporter asks him about Cuomo's comments last week. I don't know that I would expect that. And if they do, he certainly is not going to answer. That we very much know. Trump doesn't answer questions that he does not like. Angel Arriaga has subscribed on YouTube at the soy boy level, and I very, very much appreciate that. Let's see if Mike Pence is winding down here.
We are delivering a whole of government approach for our states as they deal with the coronavirus outbreak.
No, it's still propaganda. So let me update you again on the testing numbers. This increasingly is the most important. These are some of the most important numbers daily, which is how many tests are we doing? This page, covidtracking.com/data/US-daily, okay, will tell you that Trump just lied. Trump says from week to week, we doubled our testing capacity. If we roughly look at the last 7 days, you will see that we are right around 150,000 tests a day. If you look at the 7 days before that, you see that we were roughly around 150,000 tests a day. The capacity clearly did not double over the last week. So regularly lying about testing, we must get to 500,000 tests a day minimum to even have a conversation about reopening. We probably need 1 million tests a day. One model says we need 5 million tests a day. Another roadmap says we need 22 million tests a day. 150,000 a day won't cut it. Capacity didn't double over the last week from the previous week. It simply did not. It is a lie. Let's go back to the doctors.
Mr. President, we just want to show you a couple of additional slides, but also to remind all of Americans that we still have.
By the way, I feel much better having not listened to Pence.
Is both in the Boston area and across Massachusetts and Chicago, to really that our hearts go out to those cities as they continue to struggle with coronavirus and the consequences at the hospitalization, to all the healthcare providers that are on the front lines. We wanted, so these are just an illustration of the different types of equipment that are out there, describing them both as low speed, But
this is propaganda. What we need are test numbers. Pictures of what the tests look like, less relevant. We've got to be doing more testing. We've been stagnant for 2.5 weeks.
Equipment range from all those different, and that's why there's 5,000 of them as noted by the president in this list. We wanted every governor and every state and health laboratory director to have a clear understanding of the full capacity within the state, both for the capacity, but also where technical assistance and additional supplies may be available. And we were proud to put the federal labs on that list because the military and the VA have stepped up every step of the way to provide support both in testing and care. And we have many military members on the front lines, and I'm sure the military would offer their facilities to the governor of Maryland or any governor who wanted to utilize those to expand testing. So the next slide, I'm just going to run through them very quickly. So every governor not only received the Excel spreadsheet with the complete list of the equipment and the zip code of the location and the laboratory to really be able to create a mosaic of laboratories of the high speed and low speed equipment together to meet the needs of their clients, depending if they're drive-through or hospital needs. So this is what Florida looks like. Next slide. This is what Louisiana looks like. Next slide. Maryland with significant capacity. Next slide. Virginia with significant capacity throughout the state. Next slide. New York, obviously a lot of capacity in New York City with overlapping capacity. It's important to know where this is because then hospitals and labs can support each other when they need surge.
I'm going to pick up one of the Abbott tests soon.
This is New Jersey. Next slide. Pennsylvania. Next slide. Massachusetts. Next slide. Ohio. Next slide. Oklahoma.
Okay, I mean,
next slide.
I think we get it, right?
Washington.
Like states
next
have
slide.
tests.
I think that's Wyoming. So we wanted
Wyoming
to show
doesn't look
both
so
in
good.
states that have large populations and in states that have lower populations. You can see
Right,
that
it's a good question people are asking. Like, what exactly do we learn about capacity from this when the numbers don't move?
the Walter Reed Group and the American Society of Microbiologists and all the lab directors to really create a web of understanding of what the capacity is currently, what the capacity can be, and how the federal government can support them in developing their strategies linked to the overarching federal strategy of testing as outlined in our guidelines. Thank you, Mr. President.
Question for Dr. Burks? Yeah. Dr. Burks, University of Southern California and the LA County Public Health put out a report today that suggests that the penetrance of the virus is as much as almost 40 times what it was believed to be, that as many as 442,000 people in LA County may have been infected, which suggests two things. It suggests that you have a lot more people out there who could be spreading the virus, but it also suggests that the case fatality rate is more in line with the 2017-2018 flu than what we've seen in some other areas of the world. But I'm wondering if you've seen that, what your thoughts were.
So we're looking at all those studies very carefully, and I think you will remember over the last 3 weeks I've been talking about the level of asymptomatic spread and my concern about asymptomatic spread because with flu and other diseases, when people are sick, it's easy to contact trace. When people are not sick and shedding virus, you have to have a very different approach, a very different sentinel surveillance approach, a sentinel monitoring approach, which we outlined in the guidelines. And it's why the guidelines took that very seriously. We knew that was unique for respiratory diseases, but it was because we were very concerned about the level of asymptomatic. And if you remember, we talked about younger age groups may have more asymptomatic disease, and your asymptomatic disease may decrease with your...
With respect, the question is, does she buy that there could be a 40x infection rate or not?
Groups. This is still our working hypothesis. We have no data right now still to support that, but it's these kinds of studies that help that. We know that New York and Detroit and other cities are very interested, which we want to also support them in testing for frontline responders, first responders, and healthcare workers because we think their exposure may have been the greatest. What we don't want to do, and I'm just going to do another 30 seconds on testing. These tests are not 100%.
Okay, she didn't address the study, though.
Specific. And I'm going to go over this over and over again. So if you have 1% of your population infected, and you have a test that's only 99% specific, That means that when you find a positive, 50% of the time it will be a real positive, and 50% of the time it won't be. And that's why we're really asking people to start testing in among the first responders and the healthcare workers that may have had the greatest exposure, because that's where the test will be most reliable. And then when we have the luxury, we can go out to broader and broader communities. But this has been the fundamental question to begin with and has been persistent. And we will emphasize to the American people again, this is a highly contagious virus. And we don't know by looking at someone whether they have pre-existing conditions or not. And so all of us, as far as protecting others, must continue to do all of the recommendations to ensure that when we are in an asymptomatic state, we're not passing the virus to others.
Question for you as well. The governor of South Carolina announced today they're going to open some stores with restrictions, but they just told my colleague Natasha Chen that they have not achieved that criteria in the White House guidelines about the downward trajectory for 14 days.
Obviously.
So shouldn't they not be reopening stores today?
We have asked every governor to follow the guidelines, just as we've asked every American to follow the
they're not doing
guidelines
it.
put out by the president. But each of the governors can decide for themselves whether they've reached specific guidelines in specific areas. I had a question, I think, on Saturday about Jacksonville and their beaches. So I did spend about 5 hours going to every state website, and I will tell you that the Florida Department of Health website is extraordinary. And this is what every Department of Health should have. Because when you go to that website, you can see that most of the cases are in southern Florida, in the Miami, Fort Lauderdale, Broward County area. And if you look in Jacksonville, they had less than 20 cases per day and less than 800 in 4 weeks. And so these are the kinds, when you inform the public and give them the information that they need, then they can make decisions along
So
with
now
the
she's saying, well, actually, even without meeting, we're saying you really should meet the guidelines, but here's a whole bunch of ways to justify opening without actually meeting them.
seen it myself. But I know from Jacksonville that they had less than 20 cases a day. And so this is how we need to start informing the
Jacksonville
community.
testing?
These websites are critical. It's by zip code and it's by county. They can see cases, they can see cumulative cases, they can see new cases, they can see hospitalizations, they can see mortality, they can see age groups of mortality, and they can see where every testing piece is. This is how we have to inform the American public, and this is where the American public will develop confidence in each of their counties and local governments.
I was hoping you could comment. The Vice President mentioned that there's enough testing capacity right now to proceed to phase 1. But what about phase 2 or phase 3? Are there enough machines or enough cartridges? Are there enough reagents
There's
right
not even
now
enough go to
for the
phase
sort
1.
of
That's actually
reopening
a
the
false
administration is
premise.
envisioning taking place over the next month or two?
So you can see the current machine outline, and you can see that both of these gentlemen have prepared to have everything ready for phase 2 and preparing it now for what we will need in the future. And I think
This is a fantasy. The testing is not actually increasing. Telling us how many machines have been manufactured is very different than having capacity. And anyone can look at the official testing numbers. It's been up and down in the same range for weeks at this point. This is not true.
I would just agree with Dr. Birx completely. We are ready right now to enter phase 1, and we are ramping up all our capabilities across the board,
Oh,
not
God.
just to achieve what's necessary for phase 2, but 2x, 3x, 4x, so that we will be absolutely over-prepared when the nation is ready to go into those phases.
Wow.
And by the way, not everybody agrees that we have to do that much testing. We're going maximum. You understand, there are some people who don't want to do that
That's
much
two
testing.
lies in one.
But we're going maximum. We're going to the outer limits, and I think that's the way probably it should be. Jeff, go ahead.
Mr. President, to return to a topic that you opened the press conference with on oil, U.S. crude futures today went below zero, went into negative territory.
Went negative.
Yeah.
Like interest rates, they go negative.
Does that make you want to see Saudi Arabia and Russia and OPEC Plus do more
Well,
to
it's for
reduce
short
supply?
term. Much of it has to do with short sellers. Much of it has to do, if you look a month into the future, I think it's at $25 or $28 a barrel. So a lot of people got caught. They got caught, and there are a lot of people that are not too happy because they got caught. So if you take a look at it, you'll see it's more of a financial thing than an oil situation. But because you take, I believe, in a month or so, in other words, go a little bit out, it's at $25 and $28 a barrel. So it's largely a financial squeeze and they did get squeezed.
So would you like to see, however, Saudi Arabia and other countries make more
Well,
cuts?
we've already done that, where Saudi Arabia's cutting back, Russia's cutting back, Mexico's cutting back, and the OPEC plus, they call it OPEC, plus additional states are cutting back.
We know.
And, you know, the problem is nobody's driving a car anywhere in the world, essentially, 184 nations. Factories are closed and businesses are closed. And so all of a sudden, we had really a lot of energy to start off with, oil in particular. We had a lot. And then all of a sudden, they lost 40, 50% of their market. So it just stopped. So it's going to be picking up, and the energy business will be strong. But they cut back. It could be 20 million barrels, but it's, let's say, 15. And that was between Russia and Saudi Arabia. But this had to do with the squeeze, and it was a very tough squeeze. A lot of people got...
You don't think they need to do more right now?
Well, they're going to do more by the market, to be honest. Look, same thing over here. If the market is the way it is, people are going to slow it down or they're going to stop. That's going to be automatic, and that's happening, yeah?
Mr. President, on criminal justice reform and these SBA loans, I got an email earlier this morning from a fella in the Northwest who owns a supply business. And he has a felony on his record, nonviolent felony, in the past 5 years, which under SBA guidelines makes him ineligible for one of these PPP loans. So he has now had to let go 50 employees, many of whom are criminals trying to get back into society. I don't believe there's anything in the CARES Act that would restrict.
If you give me the name of the company and his name, I'll have that checked out, John. I'll do that. It's a friend of yours?
No, not a friend of mine. No, it's just somebody who contacted me out of the blue.
He called you to say he's a criminal and
Trump. It's inconceivable for Trump that somebody might care about somebody who's not their friend. Notice how amazing that was. Trump's like, it must be a friend. Why else would anybody do something for somebody you don't know?
Glenn, go ahead.
If these companies that open and they have employees come back to work and they get sick, will these companies be liable?
Which companies are you talking about? Under
Any
what?
companies that open, manufacturing, any kind of company that opens,
So
employees go back to
we
work,
have-
they get sick, will the
I'll
company
give you an
be liable?
answer to that. I'll give you a legal answer to that when we look it up. But we are trying to take liability away from these companies. We just don't want that because we want the companies to open and to open strong. But I'll get you a legal opinion on that. I'll get you, well, that's what I'm saying. I'll get you a legal opinion on
You
that.
guys haven't discussed that yet?
Nobody's discussed it, no, but we will now.
Have any business executives have voiced concern to you about being liable
Not one.
potentially?
Not one.
They didn't say
Not
that on
at
the
this
call
point.
last week?
But we're going to look because they have talked about general liability.
Nobody's ever.
So I'll get you a specific answer from the lawyers, okay? Go ahead, please.
Thanks, Mr. President. I wanted to follow on oil. When you were talking earlier, you were talking about the PPP deal and then mentioned the SPR. In the first stimulus package, even though you had announced
Well,
that
but you know the price of oil right now, don't you?
I do. Do you know the price
I do.
of oil?
I actually do.
It's negative
I actually do.
$37.
Of course,
Yeah.
nobody's ever heard of negative oil before, but it's for a short term.
Right.
In your opening remarks, you were talking about the PPP deal, and then you mentioned the 75 million barrels of oil that you previously had said you wanted to purchase.
Yes.
You weren't able to get funding for that in the first deal. So I'm wondering, are you...
Well, at the price you're talking about, you don't need funding. They pay you, see? You know?
If you can go get it
Because right
in the
now,
next
if you can
24
get it,
hours,
that's true, if you can get it.
So my first question is, are you asking for that
Well,
funding
at a
as part of
minimum,
the PPP
we'll let people
deal?
store, so we'll store it, we'll use it as storage, and charge for it. But people need storage desperately, and we have
I
massive...
haven't gassed up my car, and I can't even remember one.
Requirement of the PPP interim funding deal.
It's
that's
not a
coming
question of
together.
requirement. If we could buy it for nothing, we're going to take everything we can get. The only thing I like better than that is where they pay you to take the oil.
I was just paid $1,200 to store gasoline in my garage. I said, sure, why not?
See that. But no, we'd like to have Congress, this is a great time to buy oil, and we'd like to have Congress approve it so that we could, instead of just storing it for the big, usually the big companies, because I think we have 75 million gallons right now capacity. That's a lot. It's we've been building it up over a period of time.
Yeah,
but
I've seen people worried about my car. I'm not literally not driving. I go to the grocery store. You know, I'm doing minor things. The car is being driven. Don't worry. I'm exercising the gaskets.
The other, it will be full. Okay, please.
Mr. President.
Go ahead. You finish up. We'll go right to you.
Yeah. Some senators, including Senator Kramer, have called on you to stop Saudi oil shipments that are on their way right now. Is that you can do that under Section 232? Is that something that you would consider?
Well, we'll look at it. I heard just as I'm walking into the room, we certainly have plenty of oil. So I'll take a look at that, okay? Yes, please.
Questions. First on testing, the second on the SBA loan program. When will you in fact invoke the DPA to force that company you mentioned to ramp up production of
Well,
medical swabs?
we really don't need it. We use it, we go up, and I've used it a lot. But we use it, and
These
then
numbers suggest we do.
sometimes all they have to do is see it coming. Do you want to talk about that, Admiral, please?
I think this is, I don't think any of us knew very much about the DPA, but there's sort of a force side of the DPA where you force a company to do something, but there's a second side of it, which is really a hand up. The company we're talking about has done everything to support this effort and have ramped up production. I'm on the phone with them multiple times a day. This is the hand up. This is the government coming in and saying, how can we help you expand your lines? There's no asynchrony here at all. So this is the hand up side of the DPA, which is exactly what these small American heroic companies need. They don't need to be forced. They're all in. Their employees are all in.
So point of clarity.
And we don't want to embarrass people either. Please, Brett, go ahead.
So today, we were on site, or there were folks on site with that company, finishing out what their capital projections will be in order to be able to ramp up these additional 4 lines that I spoke about. The company will then turn in a white paper to the DoD that will then help move the process forward, but it's actively in process.
And I fully understand that the need is enormous, but on March 21st, the administration promised 27 million tests by the end of March. So far, roughly 4 million people have been tested. So where are the other 23 million
Nasty
or so
question,
tests?
no
Did they
answer.
not
They're
materialize?
missing,
Are
they
they in
don't
the pipeline? Help us understand that discrepancy.
So since I was the one who said that, let me explain where we were. So I was getting my information, it was correct information about the actual tests that are in the marketplace. So if you want to use those metrics, there's been over 40 million, quote, in the marketplace. But we have an end-to-end issue that we needed to deal with, and that's what we've been dealing with. The swabs, the transport media. If we don't have people utilizing the machines
So we're a month late and 16 million tests short. Am I doing, or was it, wait, what was the number? 27? What was some crazy number?
have a lot of tests in the market, and those are correct numbers. But if the machines aren't utilizing them and they're not organized at that level, then they're not being utilized to its fullest.
So
And that,
you meant if the machines were utilized, that would be the
you would have a lot of those.
Can you imagine? Oh, we've got 27 million tests. We're just not using them. Oh, well then everything's, you guys were right all along.
That could be done if the machines were utilized more fully.
Unbelievable.
Guerrero?
Well, yes.
Admiral Guerrero, you say that there, and the Vice President has said this, Mr. Smith said it, that there will be enough tests in place for phase 1.
There are.
There are. The question is,
That's a lie.
what's the standard of testing that you now have the
Right.
capability for? Is it test people who are only very ill? Is it test people who have the sniffles? Is it test people who come in just because they want to get a test? I mean, what is the standard here for the
It is the
testing?
guidelines, but I tried to be a little specific about this on Friday, and we all tried to. Number one is you need to test everyone who's symptomatic, right? And you need to over-test them because
How symptomatic?
we're talking any symptoms that would be consistent with COVID, right?
They don't have the test
So,
for that.
and there's a
Well,
wide
I mean,
range of
it's a
symptoms.
lot.
You
They
want to
don't have
test
the test
them,
for
and you want to over-test. And we talked about the approximate metric with Ambassador Birx fully supports, because this is a good metric that you want to get about 1 positive for every 10 tests. Then you know you oversample. Second, and this is a really important part of the strategy, is because so many people are asymptomatic, there's no way that you can test enough people to pull one asymptomatic out of 300 people in the population. So the strategy with Ambassador Birx offered, and I talked to epidemiologists around the country, and they go, wow, I wish I would have thought of that, is to really focus on the vulnerable population where we know that the asymptomatic rate could be much higher than the rest of the population. And we are going to be focused, and this is what my office does, and during normal times.
I want to be really clear. If you're feeling like maybe you're dumb, and I'm being serious, because you're not getting this, you're not dumb. They are incoherent about this. They won't tell us what is the number that we need. They say tests doubled over the last week. The numbers show that they didn't. You're not dumb, okay? They're not ready. They don't have the capacity. They're not telling us the truth.
that most of the models and people don't talk about, because that's where we're going to pick up the asymptomatic carriage. And when you do that, that's when you focus on track and trace.
So just a quick follow-up on that. If we have enough tests right now for everyone to go into phase 1, why is the governor of Maryland having to get 500,000 tests from South Korea?
Correct.
I don't know what the governor of Maryland is doing in South Korea, but there
That's called
is
an
excess
opt-out on that
capacity
question.
every day. If he wanted to send 30 or 40,000 tests to LabCorp and Quest, that could be done. That could be done tomorrow.
Enough that they needed to start to up their testing capacity and make it adequate. So
I
they
think
had to
I
have
think
these
we're seeing
late-night
all
meetings.
across the country that in the states that have been hardest hit, their capacity, not only their capacity, their testing far exceeds South Korea. And they've been able to do that on a relatively straightforward.
The issue isn't whether they're exceeding South Korea, it's that they're buying tests from South Korea. Look at this.
Call today.
But you haven't spoken to him like personally on this?
Go ahead, Mike.
We spoke to Governor Hogan today. I'll follow up because
They
I heard
pull
there
in
was an
Pence when
announcement
nobody has an answer.
today that he had acquired some tests from overseas. Maybe we could put the slide back up that showed
Yeah, put a slide up.
the
Please
number of
distract from a
facilities
good
just
question.
in the state of Maryland. And part
Now they're going
of
to
our
just show us dots on a map.
governor placed the order from South Korea. Wouldn't begrudge him or his health
Guys,
officials for ordering
look at the dots.
tests. But
There's dots.
the capacity of all the different laboratories and the number of machines that are across Maryland was part of what we were communicating today.
I
including-
hope it's clear to everyone the dishonesty and the misdirection on the testing, okay? They won't tell us what number they need. They claim testing is doubling when it's not. Everybody fails, so they abort and they get Pence up there. And he says, show them the dot picture. Show them the dots.
Describe it as well as the doctors here, but it's the contact tracing piece. We really believe that states that meet the criteria of 14 days of cases going down and proper hospital capacity.
Yeah, none of them
if
meet
they
that.
test people that have symptoms, and if they deploy resources to vulnerable populations, nursing homes and other designated vulnerable populations where we believe the threat of serious outcomes from the coronavirus is real. Then we also today inform the governors that we will be deploying CDC teams to every state and every territory in the country to assist them in contact tracing. Governor Jared Polis raised a very good point about the legislation the president is currently negotiating on Capitol Hill. He recommended that we make sure that the new bill that has some $25 billion in testing resources also cover contact tracing expenses by states. We assured him our administration strongly supports that. We communicated that to the Secretary of the Treasury and the rest of our negotiation team, and we'll be pursuing that. But we were able to tell every one of the governors that we will be deploying teams, we think of 10 or 12 for a start, from CDC to reside in all of our states and territories to supervise and work with contractors.
Remember, the question was about testing capacity. I mean, it's just such a depressing, insane situation with these tests.
Keep a careful eye and monitor your vulnerable populations. And when you come across a case, have a team on the ground that can do the immediate contact tracing and testing. And that's how we restrain and contain
infuriating.
the
It is.
spread of the coronavirus during phase 1. And frankly, it's the beginning of the structure for how we contain the coronavirus going forward.
And take a look at that map. The governor of Maryland could have called Mike Pence, could have saved a lot of money. Look at these different places.
That's not tests.
And that's Maryland right
Can
there.
you imagine
So
Trump's pointing to
could have
testing
saved a lot of money,
location?
but that's okay.
To go to South Korea for
No,
this
I don't think he
testing
needed to go to
kits?
South Korea. I
Have
think
you
he
guys-
needed to get a little knowledge would have been helpful.
On the SBA loans, do you think it's right that major corporations, major institutions like the Ruth's Chris restaurant chain like Harvard University apparently got a lot of money under the CARES Act, money that was supposed to be earmarked for small business owners? Do you think that's fair?
Well, I know one thing, I didn't get any. That's for sure.
Wasn't the question.
I didn't get any. We'll look at individual things, and some people will have to return it if we think it's inappropriate.
But should the criteria be changed that that money goes to people who need it?
Well, it's being done by great professionals. It's being done by banks, and as you know, community banks all over the country. That's what they do. They loan money, and they're supposed to do it according to not only criteria, but according to what we think is right. But if somebody got something that we think is inappropriate, we'll get it back. Okay? Good point. Please, go ahead.
Yes, a different question about South Korea. There are reports that you are personally negotiating with President Moon the terms of reduction of U.S. forces on the Korean Peninsula, and that there are 4 scenarios involved. Can you confirm that? And if so, what is your desired outcome?
Well, I think that South Korea had a great talk with President Moon. He's a friend of mine. I congratulate him. He had a wonderful election victory. I was very happy about that. He was, as you know, just recently. We are negotiating for President Moon and for South Korea to help us monetarily, because we, as you know, we have...
All right, guys, as I said earlier, we have a debate that I'm moderating tonight. It's not live. It's being recorded. I'll tell you more about it after it's done, but I do have to now wrap up the stream because this is the only setup I have, and I need this setup in order to film that debate. So I will leave you here. We'll pick it up tomorrow, clips, all of that stuff, and I'll tell you more about the super interesting debate coming up.